Schizophrenia word given by Jürg Bleuler, Swiss psychiatrist in 1908. Life expectancy in schizophrenia, 1-20 years. Meaning of schizophrenia, schizo, split, and phren, mind, split brain theory given by Roger Sperry. In 1899, Emily Kraepelin proposed dementia praecox, later known as schizophrenia. Schizophrenia, severe disturbance in thinking, thought, cognition, emotion and behavior. Causes and risk factor of schizophrenia: excessive serotonin, 5-hydroxytryptamine, metabolite into 5-HIAA, 5-hydroxyindole acid, first priority, and dopamine, second priority, deficiency in gray matter, enlargement of lateral and third ventricle. Drug abuse with amphetamine most common associated with paranoid schizophrenia. First rank symptoms of Schneider's: 1. Auditory hallucination, 2. Thought withdrawal, insertion, or interruption, 3. Thought broadcasting, 4. Somatic hallucination, 5. Delusional perceptional, 6. Feeling or action as made or influenced by external agents. Positive symptoms of schizophrenia: due to increased dopamine in mesolimbic pathway, delusion, hallucination, excitement or agitation, hostility or aggressive behavior, suicidal tendency, suspiciousness, idea of reference. Negative symptoms of schizophrenia: due to increased 5-HT in mesocortical pathway, affective flattering or blunting, avolition, lack of motivation, apathy, lack of emotional feeling, attention, impairment, andonia, unable to experience to pleasurable event, alogia, lack of verbal communication, social skill training done for negative symptoms. Sign and symptoms of schizophrenia according to Eugen Bleuler or Bleuler 4a, A1, ambivalence, coexistence between two opposite emotion-related disorder, limbic system, fragmented thinking, daughter to father as I love you / I hate you, or inability to decide for or against. A2, autistic thinking and behavior, excessive fantasy thinking, withdrawal into self or social withdrawn. A3, affective disturbance, emotional disturbance, not suitable according to situation, laughing on death. A4, loosening of association, loss of connection between idea and sentence, patient shifting one idea to another, no logical connection, can't put sentence in order. Bizarre delusion most common seen in schizophrenia patient. Secondary or accessory symptoms of schizophrenia: perception-related, third-person-related auditory hallucination and visual hallucination, thought-related delusion, fixed false belied. Circumstantiality, thinking process slowly with unnecessary and trivial, little worth, details but finally reached at point, seen in epilepsy patient. Perseveration, get stuck on idea or topic. Neologism, newly coined word or expression. Word salad, utterance of word without any meaning or coherent, Rahul /name /my. Derailment, loosening of association. Echolalia, repetitive of word just spoken by another person. Clang association, grouping of word usually based on similar sound, word, haven't logical reason to group together, X. I have gold, sold and fold. Paranoid schizophrenia, feeling that being threatened by someone in some way, delusion of persecution or grandeur without hallucination, most common type of schizophrenia, good prognosis, false belief that someone want to kill or threat me. Hebephrenic schizophrenia or disorganized schizophrenia, get name from green word for adolescence, affect individual around puberty 15-25 year of age, second most common type of schizophrenia, poor personal hygiene and prognosis. Catatonic schizophrenia, abnormal muscle tone, excited or stupor or rigidity posture, Rx, lorazepam 4 and ECT. Residual schizophrenia, negative symptoms present. Undifferentiated schizophrenia, clinical feature present but can't classified into any subtype. In schizophrenia, clozapine is more effective than haloperidol against social withdrawal symptoms. Organic disorder, F00F09, pathological condition of CNS, EX delirium and dementia. Delirium, most common organic disorder, also known as acute brain syndrome, consciousness-related disorder, short-term or temporary cognition loss, and it can be reversible. Most common cause of delirium, post-surgical anesthesia or vitamin B1 deficiency. Signs symptoms of delirium, clouding of consciousness, disorientation, unable to maintain attention, most common hallucination, visual hallucination. Sundowning syndrome in delirium, state of increased agitation, confusion, disorientation, and anxiety typically occur in late afternoon or evening. Set strict schedule for morning and evening, walk with assistance, most common disorientation, time. Diagnosis for delirium, MMSE, Blender Visual Motor Gestalt Test. Management of delirium, administer vitamin B1, thiamine, 100 mg for electrolyte correction and protect from injury, first priority. Dementia, also known as chronic brain syndrome, irreversible, most common onset 65 years of age or also called senile dementia. Pre-senile dementia, dementia onset of dementia after 45 years of age due to PIC disease, frontotemporal dementia, most common cause of dementia under 60 years of age. Sign and symptoms of delirium, permanent cognitive impairment, decrease intellectual function and lack of hygiene. Most common cause of dementia, Alzheimer's disease. Causes of dementia, Alzheimer's disease, decrease acetylcholine, hypothyroidism, CVA. Stages of dementia, 1 early stage, 2-4 year, judgment deficiency, recent memory loss, hesitation and forgetfulness, 2. Middle stage, 2-12 year, confabulation, aimless wandering, immediate memory loss, social isolation and lack of hygiene, 3. Final stage, up to death. Most common cause of death in dementia, risk of aspiration. 4A symptoms of dementia, 1 apraxia, difficult with skilled movement, unable to make gesture or voluntary movement, 2. Agnosia, loss of ability to identify object or people, 3. Aphasia, trouble with speaking or understanding other people speaking, 4. Alogia, lack of speech or poverty of speech, other symptoms as déjà vu, familiar with unknown, jamais vu, unfamiliar with familiar. Management of dementia, protect from injury, provide family album to recall memory, apply wrist ID band and maintain personal hygiene. MMSE, Mini Mental Status Examination, used to evaluate cognitive functions like dementia and delirium, 1 orientation, 10 points, 2. Attention and calculation, 5 points, 3. Language, 9 points, 4. Recall, 3 points, 5. Registration, 3 points, maximum score, 30 and minimum score, 0-5 normal, 25-30 point, mild dementia, 19-24 points, moderate dementia, 13-18 points, severe dementia, less 12 points. MSE, Mental Status Examination 1. General appearance, 2. Psychomotor activity, 3. Mood and effect, 4. Speech, 5. Disorder of content of thought, 6. Disorder of possession of thought, 7. Disorder of perception, 8. Higher mental function like memory, attention, intelligence, and abstracting thinking. Hindi mental state examination, screening test for illiterate demented patient, given by Mary Ganguly. Ego-syntonic, agreeable to self-personality disorder. Ego-dystonic, disagreeable to self-OCD. OCD, also known as anankastic personality disorder, uncontrollable, recurring thoughts known as obsessions and compulsive behavior to repeat an activity consistently to relieve anxiety generated by obsessions. Exposure response prevention therapy, ERP type of cognitive behavior therapy, which very effective in treatment of OCD. Age of onset of personality disorder, early childhood to adolescence. Type of personality according to DSM-4, text revised in 2000 DSM-V, as below. Cluster A1. Paranoid, suspicious, sensitive, untrustful and grandeur pattern, 2. Schizoid, shyness, unable to form warm, close social relationship, emotional coldness in sexual activity, cold, aloof and social isolation, 3. Schizotypal, magical thinking, odd behavior, abnormal thinking, and unable to maintain personal hygiene. Cluster B1. Antisocial, exploits other but don't improve self-status, violate rules and regulation, don't respect of others and don't show guilt for abnormal activity, 2. Narcissistic, exploit other and self-improve, black magic show and 3. Borderline, always in state of crisis, impulsive behavior, self-harm, unstable relationship 4. Histrionic, more common in female, sexual seductive behavior and excessive emotional expression. Cluster C1. Avoidant, anxious personality, excessive sensitive and don't want to take responsibility, 2. Dependent, depend on other for every decision, take support for activity and don't have independent capacity 3. Anankastic, obsessive compulsive personality, time-bound and rigid behavior. Type of personality according to Carl Jung, 1. Introvert or introversion, inner fantasy world, 2. Extrovert, contact with external world. Type of personality according to Sheldon, 1. Ectomorph, 2. Mesomorph, 3. Endomorph. Neurotic, stress-related, and somatoform disorder under ICD-F40-F48. Neurotic stress-related disorder including anxiety disorder, phobia, OCDs, post-traumatic stress disorder, adjustment disorder, and dissociative disorder. Post-traumatic stress disorder, PTD's reaction to extreme trauma, which cause pervasive distress to individual. Traumatic events include disaster, combat, war, rape, torture, terrorism and other crime. Screening for PTDs, detachment, re-experiencing event has emotional effects, avoidance, month in duration and sympathetic hyperactivity or hypervigilance, on constant red alert. Clinical feature of PTDs, recurrent, unwanted, and distressing memories of event, flashbacks and nightmare, avoiding places and activity or peoples that remind of traumatic events, negative thought and belief about self, people, or world, vivid memory and stress when exposed to similar circumstance. Nursing intervention with PTDs, calmly reorient patient to current situation. Somatoform disorder, Group of psychological disorder in which patient experience physical symptoms which can't be fully explained by general medical condition. Anxiety, irrational worried about imaginary danger or subjective experience include apprehension, uneasiness, and uncertainty. Most common psychiatric disorder according to WHO, anxiety-related disorder, and according to NIMANS, depression. Cause of anxiety, decrease GABA, gamma-aminobutyric acid. Doc for anxiety, benzodiazepine, clozapine, alprazolam, and lorazepam. Psychotherapy for anxiety, cognitive behavior therapy and supportive psychotherapy. GAS, general anxiety disorder, severe level of anxiety that lead to insomnia, easily fatigue, poor concern, and muscle tension. It should be present at least 6 months. Panic disorder, seen in agoraphobia, feeling of impending doom, something tragic or life-threatening, characterized by palpitation, sweating, feeling of dying and feeling of unreality, depersonalization, detached form self, derealization, detached form other. Symptoms of panic disorder, peak level within 10 minutes and resolved in 30 minutes. Doc for panic disorder, antidepressant, in acute panic attack, benzodiazepine, cognitive behavior therapy and relaxation therapy. Aaron Beck's cognitive theory for anxiety disorders, one negative view about self,